Cryopreservation is basically a treatment that we provide to freeze or cryopreserve eggs, sperm, or embryos, basically. Patients who want to preserve their fertility prior to any chemotherapy or radiation come in and give sperm, and we freeze their sperm for future use. Patients who want to freeze their eggs, either because of chemotherapy or because of they want to freeze their eggs and freeze time. Young ladies without partners, for example, would then come in and freeze their eggs. Patients who have extra embryos that they did not use in an in vitro cycle can cryopreserve their embryos for future use. Patients who are doing egg freezing basically go through the process of in vitro fertilization, get all the drugs that you would get. They go through the process of the retrieval in the operating room. The only difference is instead of adding sperm to the egg, fertilizing it, and creating an embryo, they just freeze their eggs and reserve the right to use them in the future with any sperm they want to. Patients who freeze embryos are freezing eggs that have already fertilized and divided, and we freeze those for their future use. And patients who want to freeze their sperm are freezing their sperm for future use. That technology is great and is improved over the past few years, thereby allowing patients to have an extension of their fertility into the future. For example, if a patient just met their partner and wants to have a baby with that person, but not immediately, they can come in, we can retrieve their eggs, fertilize the embryos, freeze them, and they can go on and have a life and then come back and have a baby. No rush in having a baby. Patients who don't have partners, they can come in and freeze their eggs and sperm and not be worried about the biological clock ticking in the female patients, for example. So basically, it's a treatment that is available and quite effective.